You are listening to the Berman Method podcast featuring Dr. Jake Berman and Jenni Berman, physician assistant, where we treat problems, not symptoms.
And we're back. The Berman Method. Dr. Jake Berman here with my beautiful wife, Jenni Bear Berman. Say hello.
Hello, everybody.
Jenni is a physician assistant who specializes in nutrition, and I'm a physical therapist that specializes in functional manual therapy and golf, right?
And golf.
Oh, golf. We're starting to drop that in here a little bit too. We want to keep talking about treating problems and not symptoms. That's what this whole podcast is about. It's the Berman Method. The Berman Method is our way that we have been treating over the years, where we are focusing on treating problems, not symptoms. One of the examples we like to use is the headache. When somebody has a headache, they quickly take some medication for it. They'll take a ibuprofen, Tylenol. What are some other things?
Advil. Naproxen,
BC powder.
That's a good one.
Yeah, that's a quick one.
Excedrin.
To get rid of the headache. But it's very rare that somebody says, well, what caused my headache in the first place?
Dehydration.
Ooh.
Sodium in your diet.
Yeah. So the list goes on and on. There's these other things that could be causing the headache in the first place. Yet the first thing we do is we go and we get a pain pill or Advil to get rid of the symptom, which is the headache, versus fixing what the cause actually was. So that's what the Berman Method is about. We're all about trying to fix problems, treat problems, and not the symptoms.
Hey, did you know that a magnesium deficiency can cause headaches?
I did not know that.
Did you know food allergies can cause headaches?
I did not know that either.
Okay. Those are for different times, but I just wanted to throw that out there.
Oh my gosh. Thank you.
This is what happens when you give me caffeine.
What?
I'm just kidding. I didn't have any caffeine today.
I was going to say, you're holding out on me?
No, I didn't have any. But that's what happens to my brain when I do have some.
Squirrel. Shiny object. What are we talking about today? Today we want to talk about objections, the most common objections that we hear when people are interested in doing business with us, but they are reluctant, resistant, not committing, non-committal, whatever you want to call it. So we're going to go over the most common barriers and try to make them as clear as possible, because it doesn't have to be that way. Let's start with you. What is the number one most common objection that somebody would have not wanting to come work with you for nutritional coaching, nutritional advice, or weight loss, or
functional medicine, we'll call it.
Let's call it functional medicine. We just want to be as clear as possible so people know exactly what we're talking about, because there's still a lot of people out there. If you say functional medicine, they'll say, what the hell does that mean?
It's true.
So let's just say
dietary approaches. Yeah,
so natural weight loss, food allergies, food sensitivities. What is the number one most common objection that people have not wanting to work with you?
Do I have to give up my wine? I heard that yesterday, and I hear that a lot. Do I have to give up my alcohol? Do I have to give up my wine? But, to summarize it or make it a little bit more general, it's the lifestyle. They are afraid that they're not going to be able to continue to live their life by doing these dietary changes that we're discussing.
I get it. That's one of my things, especially when I see somebody on the beach or in the gym that is shredded, ripped, nasty. The first thing I say is that guy does not have a life at all. His whole life is working out.
And it's not true. I tell my clients all the time, we want to develop a lifestyle for you, a healthy lifestyle, but we want to develop something where you can continue to go to your social events. Here in Naples, Florida, going out for dinner is the thing to do. You do it multiple times a week when you're in that retired community.
5 times a week.
Yeah. For some of our clients, yes. When you're in that retired life, you're in all these different clubs, all these different communities. You're constantly going out to dinner because that's the time to socialize with these individuals.
One of Sally's Kitchen,
Yeah.
One of our patients, she calls the club going to the club for dinner. That's Sally's kitchen. We're going to Sally's kitchen for dinner tonight.
Because they go there 5 days a week. So that's their norm. Whereas me and you, we actually eat in Jenni's kitchen, my real kitchen where I cook 5 days a week.
Do you remember the first time we ever went out the plan was to go have dinner with Sally. And when we get there and we say, okay, what are we having? She goes, oh, we're going to go to Sally's kitchen. And we're looking around going, it's right over there.
And there's no food here. We were scared.
Anyways.
Yeah. So, people are afraid that they're not going to be able to continue this social life that they have when they have to change their dietary program to include more protein, not have as many carbohydrates, moderate fats, to remove gluten or dairy, or they can't have egg. They're afraid that, one, they're not going to be able to eat anything, or two, they're not going to be able to still have this social lifestyle.
Just hearing you say all that frightened me a little bit. And then I had to remind myself that today is a breeze to do it compared to when we first started this thing, when you first went gluten-free just 5 years ago, 6 years ago, that was hard.
Yeah, restaurants didn't even know what gluten was.
Seriously, every time we would ask a waitress or a waiter, do you have any gluten-free options? The look that we would get, it's just like, did you just speak Swahili to me? But nowadays, it is not that challenging once you figure out the basics.
Once you learn. And most restaurants, going down the food sensitivity path, most restaurants have a gluten-free menu, or they actually put on their menu little symbols for gluten-free, dairy-free. So it's very easy to find something to eat at these restaurants. For all my clients, I tell them, when you're working with me, whether it's for food sensitivities or just for the macros sake, like the protein, carbs, or fat, when you're going out, send me a message or an email and say, hey, we're going here for dinner tonight. What can I have? And I can look at the menu and typically can pull out 8 to 9 things off of a menu that fit into the healthy lifestyle for someone to have.
And she does this regularly, and it frustrates the crap out of me some nights because we'll be hanging out after Stella goes to bed and watching TV or something. We'll be watching one of our shows, and she's over there swiping through the phone, trying to go through a restaurant menu for one of her clients. And then she gets done doing it, and then she asks me, so what's going on right now? And I'm going, are you freaking kidding me? Now I have to recap the whole show. But anyways.
It's because I care.
It is. She really does care a lot. And can I do a quick plug real quick for pizza?
Sure.
So a lot of people think that when you go gluten-free, dairy-free, all these things, that pizza is one of the first thing that goes out the door.
And pasta.
Mm-hmm. So I'm 25% Italian. And before Jenni, I used to eat like I was 100% Italian. Spaghetti 3 times a week was not uncommon at all. Love any type of Italian food. Pizza at least once a week. And then once we start going down this road of gluten-free, dairy-free stuff, it was challenging for me initially because I was scared. And again, this is 5-6 years ago, and there were not a lot of good options. However, I can honestly tell everybody that's listening right now, we've got this local place here in Naples called The Crust. It's a pizzeria, and I can honestly say that their gluten-free pizza is the best pizza I've ever had.
And they even have a dairy-free one.
They have a gluten-free, dairy-free pizza, and I'm telling you, it's my favorite.
It's good. And at home, we've started making more macro-friendly pizzas, like the skillet pizza that I created a recipe for, which is actually a paleo-friendly, keto-friendly recipe.
Yeah. We're getting a little bit away from the actual topic to begin with, but I just want everybody to know that there's lots of options. So let's go back to the original thing that says, I don't want to commit to Jenni. I don't want to spend the money. I don't want to commit to this plan. But really it's because they're fearing this dramatic lifestyle change, and it doesn't have to be that way.
It doesn't have to be dramatic at all. It's a step-by-step process. And really, you don't have to change everything to see progress. Usually there is some underlying metabolic dysfunction that is creating the weight loss to be so challenging or causing, the other symptoms that you're experiencing. So between figuring out these metabolic dysfunctions and small, mild changes with the support of the nutritional team, you can still live your lifestyle eating out or having your wine, having a free snack in the evening times. It's all about balance.
Ice cream?
Yeah, there's certain ice creams you can eat. My clients love the Enlightened ice cream, the Yasso bars. Yeah, there's definitely some cool free snacks you can eat.
Cool. All right. You ready to go to the next one?
Yes. Is it for you?
Yes. Ask me. What
is the number one objection that you hear from your free discovery visits?
The free discovery visits? Is it the tried PT one?
Mm-hmm.
Yeah. So that's probably one of the most common ones. So we're all cash. I'm all cash. Jenny's all cash. We're going to talk a little bit more about this in a little bit and really talk about the differences and why we're all cash. However, one of the most common things that I hear on my end is I've already gone to physical therapy and it didn't work for me. Or I've gone to physical therapy in the past and it did work, but they took my insurance. Why would I come to you? You don't. You take cash. I mean, you're just like everybody else, essentially calling us a commodity. So we actually have a list of 6 questions that you should ask the other guys if you decide not to work with us. And it's these questions that really separate the difference of what we're doing versus everybody else that are essentially cookie cutter PTs. What I mean by that is when you're in an insurance-based clinic, you have to see multiple patients per hour, usually a minimum of 2 patients an hour, a lot of times 3 or 4 patients per hour when you're in these big corporate medical PT clinics. The only way that you can see that many patients per hour is if you have a generic treatment plan. So again, if you're seeing 4 patients an hour, you've got a maximum of 15 minutes of one-on-one time with that patient. Now, you can be the best PT in the world. I don't care. It's going to take you a little bit more time to make a really good intervention for that patient for that day. A little bit more than 15 minutes to really figure it out, because you can look at things on the surface level and say, okay, you're having back pain. All right, let's get started. Let me do a little massage here, and then 15 minutes is gone. Okay, go. Here's your sheet of exercises. Go do your exercises. But again, these are generic things. If the exercises are not done 100% correctly, they are not 100% effective. It's as simple as that. So the biggest difference that you can see from a cookie cutter PT or an in-network PT versus what we do is we're 100% one-on-one the whole time. So when it's time to get the muscles working and we're exercising, we're right there saying it's not 100% correct. It's only 90% correct.
How long is your one-on-one visit?
Well, it depends. It can be anywhere from 30 minutes to an hour. Just depends on what they need. And then when we're getting the workout going, then we'll say, okay, it's 90% correct, but it's still not good enough. Keep going. We're not going to progress to the next thing until we get this thing perfect. And that's why our system works, is because we start at the basics, or the bottom, the fundamental movements. We've got to perfect level 1 before we go to level 2. We got to perfect level 2 before we go to level 3. Versus the cookie cutter PTs, they essentially are starting people at level 5 and saying, okay, go do the leg press over there. Go do these leg extensions. Go do these other things. But you're not ready to do those things yet.
And of course, this is all general statements.
No, it's everybody.
Not in
every
particular,
single one of
every
them.
single
We're
PT
the only,
out there.
We're the only good PT in the whole country, world.
But anyway, but also something that you guys do that is different from other physical therapy clinics, especially in network physical therapy clinics, is you'll look at the whole body and really figure out where the pain may be coming from, which we touched on a bit in the past. If you're coming in with back pain, we got to look at your feet and your knees and your hips and really identify, is this pain actually coming from your back, or is that a symptom that you're having? So that's very different too.
Yeah, let's do a very quick example. Knee pain. Somebody with knee pain goes to a cookie cutter PT. They're going to get generic knee strengthening exercises. So they'll get the leg press, they'll get leg extensions, they might get straight leg raises, things like that. Hamstring curl. However, when people come to knee pain at my clinic, what I can say is 9 times out of 10, the knee is not the problem. The knee pain is the symptom of a problem somewhere else. And it's usually above or below, usually in the glute, sometimes in the ankle, but usually in the glute. The butt is not doing its job, so it's putting more stress on the knee. So let's fix the butt, never touch the knee, and the knee pain goes away. That's a very common thing that happens.
And again, just briefly touching on this because we've talked about it in the past, but you're able to do these things because you're out of network. You don't have insurance dictating what you can and cannot treat, what you're getting reimbursed for and what you're not.
Exactly.
So that's why you're different from the other physical therapists that they've tried in the past.
Tactically, right? That's a tactical reason why I'm different. However, the higher 30,000 foot level is I care more about keeping you active, mobile, and pain-free than I do about your pain. If you just care about your pain, go to the cookie cutter PT, go take some pain pills, go get an injection, go do that. But if you care about what the pain is doing to your quality of life, what you're missing out on because of the pain, that's what I care about. I want to keep you active, mobile, and pain-free. So whether that's keeping you on the golf course, keeping you socializing, tennis, whatever, being able to get down on the ground and play with your grandkids, whatever it is, that's what I care about.
So going back, those people that have already tried physical therapy, they've already been to physical therapy 4 times for the same issue. It doesn't fix the problem. Why should we come to you? Why should I give you another chance? In just a brief summary. There's so much we could say about your clinic, all the way from your name being on the board when you come in to getting cookies for your birthday. There's all so much that your clinic does to make the patient know that they're the number one. But it also comes down to getting results.
That's it. It's results. So it's very rare that we're going to do multiple visits in a row without seeing results and keep going in that direction. There's a few instances where it's going to take time. Let's keep doing this redundant thing over and over again. However, we want to avoid the definition of insanity at all costs. What's the definition of insanity?
Doing the same thing, expecting different results.
Yeah, doing the same thing over and over again, expecting different results. So we preach that and we live by it really hard. We're going to keep switching it up until we figure out what is the right thing to do to fix this problem. So that's important.
All right.
So let's get into the big one.
Eek.
Drum roll, please. I don't know how that sound's going to come out with the editing. But anyways, between the two of us, between Jenni's wellness business and my physical therapy business, the most common overall objection we get is it's a lot of money. Because again, we're out of network. We don't take any insurances. We charge a lot of money too, because we are going to get some results. We're going to fix the stuff the right way. We're not doing any cookie cutter stuff. It's either Maserati or what is it? The Kia. What do you want? Do you want a Maserati or do you want a Hyundai? Do you want the Ritz-Carlton or do you want the Motel 8? So it really comes down to that. Which one do you want? And that's why we charge a lot of money, so that we can get the results that you want.
Well, not just the results, but the experience.
The experience, yes. The experience.
We care. We spend the time. Right? I mean, it goes back to what you were saying. I'm working at 8 o'clock at night sometimes when a client texts me, but I want to invest into them because they invest into us.
Yes, time is a big thing. How much time do you want? Do you want the 15 minutes at the cookie cutter PT? Do you want the 2 minutes at the GP's office when you go there for a gut issue?
Mm-hmm.
Or do you want an hour with Jenni? Do you want to be able to text her and ask her questions? Do you want her to essentially be on call and help you out whenever you need it?
It's like a concierge doctor.
But better.
But better.
Yeah, so the number one overall objection that we get is the cash. It's a lot of cash. We don't do any insurance. And the reason why we don't do any insurance is because insurance dictates the treatment. For example, let's use physical therapy. In general, people go to physical therapy with a diagnosis. The doctor will say back pain. So the patient will go to a cookie cutter in-network PT clinic and they'll say, okay, you have a referral for back pain. The interventions that PT can do must relate to back pain. If they don't relate to back pain, then there is a chance that insurance will not reimburse for it. If you do a service at a corporate facility that is not getting reimbursed, that is not okay. So it is highly frowned upon to do any type of interventions that are not reimbursed. Because again, it's all about productivity. Get them in, get them out. Let's get reimbursed for this. We got to keep the giant machine working, right?
Right.
So we don't deal with all that stuff. We want to say, you come in with back pain, but what's going on with this ankle down here? Maybe the ankle isn't working, or maybe there's something going on somewhere else that hasn't ever been addressed. Let's fix those things, which 9 times out of 10 would not be reimbursed for if they were going through insurance, and they magically get better. And then let's use some examples for wellness. Why do you not take insurance? Why is this not an insurance covered treatment?
This is huge. And it a lot of times will come to blood testing. So people have been struggling with their weight for years and years, but every test that their doctor does is normal. Well, their doctor often doesn't do the metabolic testing that needs to be done. And by that, I mean looking at something called a hemoglobin A1C, which looks at your blood sugar over a 90-day period. Looking at your insulin level, which rises as a response to blood sugar instability or cortisol levels, stress levels, and identifying these issues can really help us to treat the metabolic dysfunction appropriately. Same thing with food sensitivities. You go to an allergist and they do a IgE allergy skin test that doesn't show you anything, but nobody ever does the blood test to look at the IgG sensitivities, which could be causing worse symptoms than an IgE reaction can cause. But the doctors don't test for these things because insurance may not cover it, and they don't want to be left with the bill, or they don't want you left with the bill. In our practice, we do lab testing through a separate company who charges cost. So it's not thousands of dollars to have it done like it would be at Quest. So we can actually evaluate the client as a whole and not just by what insurance tells me I can check.
Exactly. That's huge. So it comes down to the insurance companies. It's nothing different from what we were talking about on the first few episodes, where we're essentially David against Goliath, where we are against the corporate medical system. We're trying to say, okay, let's think about this a little bit differently. Let's quit treating the symptoms. Let's spend some time, let's spend some money on the right things and actually get some results.
Right. And that's part of it too, is the time that is in general medicine. When you go to your primary care's office, they're required to see so many patients an hour, and they only have 4 or 5 or 6 minutes with you, which just isn't enough time to identify what is actually causing your issues, what is actually causing your symptoms. Where I have, for my initial consults, I have an hour. For our follow-ups, I have 20 minutes, 30 minutes, or more, 45 to 60 minutes if we need it, if we're really having some troubles. We communicate all day, every day if you want to. So I really have the ability to figure out where we need to go if we're not seeing results.
That's huge. Absolutely huge.
And same thing with you guys.
It's the same thing.
Yeah.
I mean, patients are texting us all the time. We'll jump on a quick FaceTime on the weekend. It doesn't matter. Whatever they need. And that's why we charge a lot of money for it, because we're actually going to get to the root problem. We're going to give you the service that you want. But most importantly, like Jenni said earlier, it's the experience. Do you want a great, phenomenal experience? Do you want a Ritz-Carlton experience? Or do you want a Motel 8? It's that simple. Do you want to walk across your hotel room carpet with your feet sticking to the floor?
Gross.
Or do you want to be able to eat off of the floor?
Yeah.
Essentially.
Yeah, right.
Okay, so in summary, the number one thing that people don't like to or are afraid to commit to you is lifestyle change. We busted that. But one thing for me is they tried physical therapy in the past and it hasn't worked, or they're used to 4 patients an hour and being on the assembly line. We crushed that one at ours. And then the big one is the cash thing. Hopefully we helped you guys see the value and why we're doing this. Hopefully it explains a lot more why we are all cash, and that really it is the insurance companies that are ruining the medical care system. It is them. Don't yell at me. I'm charging cash so I can provide a service that you need. Go yell at your insurance company.
Mm-hmm.
We didn't do the disclaimer yet. Remember, this is for entertainment purposes only. Make sure you consult with your own physician. Don't take any of this as medical advice. This is strictly for entertainment purposes only. And if you want more information, if you want Jenni to be your provider, you can do that. Just reach out to her. Go to bermanpt.com/wellness, and you can see everything she has to offer. Check her out on Instagram, Facebook. You can do those same things for me too. Check us out on YouTube. We're everywhere. We're trying to put out as much free content as possible because, again, we charge a lot of money. So I want you to have as much information as possible before you make a purchase, because we avoid buyer's remorse like the plague. Have anything else to say?
I think that's it.
That was fun. Thank you again for listening. Hopefully this audio is getting better and better every week. We are the Berman Method team signing out. All right.
Ciao for now.
For more information, view the show notes where you can email us, visit our website.